I would like to show you a self-treatment technique to help with your upper back. A lot of times, if we bend too much forward, our spine could be actually stuck in a forward position. We call that thoracic kyphosis. Normally, the little vertebrae are like little cylinders. When we bend forward in different level, we should be able to return. But sometimes it goes too far, it gets stuck there, then it cannot come back. So I'll show you some techniques to deal with this, and hopefully you could get it back. So one way people do is if they find a chair with a back like this, and I guess it cannot be too low or too high, then you could try to hold your neck, and I want you to go over the edge of the chair. See, you could get a crack. Okay, so if I slouch a little bit or slide down the chair a bit, I could move it up a bit. Or if I sit up really tall, I could adjust the height of that and see if you could do a couple motion to get it crack back. Some people might do it over like the armrest part of the couch. You could give that a try, but you might have to sit on the floor to go over it. So here I'll demonstrate the technique. I like these half foam roll because they're not too big. So I'll lay them down on the floor, and you're gonna end up going over it. So basically if your spine is stuck this way, as you roll over this, it could actually crack and goes into place. So here I'll demonstrate. So I will put it on the floor. I want you to lie on your back, bend your knees. You're gonna lie down. I want you to take your hand and support your neck a bit. So in this position where I want you to see you could relax your head down. So I'll just take my hand away to show you. But if you have flexibility, my head could actually touch the floor, but that might be quite straining for the neck. So you could just use two hands to stack it and just gently rest it, okay? So I would kind of end it up about an inch just below that big bump in your neck. We call it C7. And I want you to basically keep your bum on the floor. Make sure you don't lift it up into a bridge. And I want you to gently, gradually roll over this row. And I will keep going. And I'll get to about just a little bit before you hit your belly button, okay? So I usually will run about 3 to 4 repetitions to get that, okay? And if you hear a crack, I hope that'll give you a relief. So the other alternative is probably using a smaller foam roll, okay? So let's try the same technique and see how it goes. So gonna be crook line, bend your leg, go down, support your head, and then roll over it. So I will show you a technique that you could probably ask one of the family member to help you to push it, and hopefully we could push it back. Normally in the clinic, we probably will manipulate it to get that joint back, but at home you could try this technique. So here I would like to show you a technique to help with a stuck upper back. We call it thoracic spine. So when you lie on the floor, you could put the hand under the forehead, so you could rest your forehead on the hand. I would suggest you use a floor with the yoga mat, something firmer. On the mattress, it might be a bit too soft, okay? Just so that the neck is neutral. So the bony bits that you feel at your back, those are called spinous process, okay? So what we're gonna do is gonna try to push on the sides here on the bone, okay? We call them the facet or the transverse process. So in theory, if the spine, each vertebrae is stuck like this way, like bent, right? So we want to push it down so you go back to neutral. So I want you to use this part of your hand, okay? You see we actually naturally has a valley in here, okay? These two parts we call the thenar and the hypothenar, we're gonna just fit over there. So you're gonna put that bony part, spinous process, just right in there. So I'll show you, for example, here, usually we're stuck in about T4 to T6 area. So I'm gonna use this cover there. I want you to push it down. So when you push it down, the angle is not directly down towards the bed, okay, towards the chest. But I want you to angle it so it's a little bit towards the tailbone. So I want you to find the spot. So you could touch to find the spot that when you gently push on the middle part of the spinous process where you have most pain, use that spot. I want you to use that, what we talk about here, cup it, and I want you to push it. So I'm gonna lock my elbow and push it down. So it's actually a very gentle motion, almost like you're doing a CPR, but it's a very gentle motion. Don't pump too hard, okay? So I will pick, let's say, that segment here. I'm gonna put it over there. I want you to pump it. Okay, so I would do about maybe like 20 times, okay? See how that goes? Then move down just to feel. Move down one more level now, and then push again.